come out in numbers to get vaccinated in Khayelitsha near Cape Town, relieved to be getting their first dose, just like in Europe where people have been getting vaccinated for a few months already.
We've been waiting for this because it's not from here to South Africa. They have to get it somewhere else.
While passing through the vaccination centre, the Provincial Minister of Health explains that it's not easy to find vaccine stock and that vaccines are more expensive for Africans and for Europeans. There are many causes for vaccine inequality.
We started late for us even to have our own manufacturing, because in South Africa we have got academics, we have got the researchers. We should have done that. The government failed to create that enabling environment so that we could be able to use our own skills. But secondly, we need to release some of this intellectual property. We fought for the HIV/AIDS, if you recall, and all of those. So with the vaccines, it's also like that.
South Africa can produce vaccines on its own soil. This plant signed a contract to produce doses of Johnson & Johnson vaccines in February 2020. Aspen reserved 31 million doses for South Africa, but to date, only 13% of that allocation has been delivered. The rest was exported. After activists put pressure on the company, Aspen finally suspended its exports to honor its agreement. It's up to activists like Fatima to expose the details of the contract.
Our records indicate that the delay in getting vaccines to middle-income and low-income countries has been because certain markets have been prioritized in the pandemic. And the preferred customers are usually the UK, members of the EU, and the US. And if nobody else can make the vaccine, and so you're basically at the mercy of the market and you're at the mercy of the pharmaceutical companies.
While waiting for patents to be waived, the city of Cape Town announced proudly that it will be the first transfer centre for a vaccine carrying ARN messengers. But it won't be operational until 2022.